I mean, it was a family nose. Well, I had my first rhinoplasty done in Orange County, I believe like 2007. So I had, asked around, done some research on a doctor down there, went and saw a doctor. I didn't get the best vibes from him, and to be honest, I mean, if I can give anyone a piece of advice before getting rhinoplasty or any sort of plastic surgery done, it's to really get to know the doctor, ask as many questions as you possibly can, and make sure that you feel comfortable with them.
So she came in and said to me, I've been to other surgeons, they're all saying the same thing, I need to have another operation, and because her nose still had dips and grooves and divots, it would have involved grafting tissue from other parts of the face or the body.
It wasn't crooked, but because of the way that one side was more of a ridge and the other side was a dent, it came off as crooked. For a long time, I just kind of lived with it and figured that this was as good as it gets. And then I found Dr. Kotler. So I highly recommend coming in about 30 minutes before you get the procedure done, even for the saline solution.
Well, the fabulous Dana is back today, and she's had several treatments because it's done incrementally. We've layered in the filler in the past several visits, and today we're going to do a little topping off. Just the tiniest little bit, just a few micro droplets to make the bridge of her nose symmetrical and even. I'm wearing a very unfashionable but very important magnifying lenses because we want to see every detail. Dana's skin has already been anesthetized by an ointment that was placed 25 minutes before. Very important for maximum patient comfort to have the skin as anesthetized as much as possible. 6 seconds injection.
And I never feel anything.
Yeah. Okay. Now first I'm just going to prepare the skin with alcohol. Very good. And now I'm telling Dana I'm just going to have a little contact with her right cheek and left so that I can place the injection very carefully and deliberately in a small area on the side of her nose. Okay? You feel just a little pressure, a little vibration going in. Good. And all we're doing is plumping up the area right next to where she's got a little bit of an edge. You want to hold that for me, Dana, just for a second? Good. Okay, give me 1 second. Now at this point I'm going to ask Dana to take a look. She knows her nose. She knows what she wants, and her opinion, of course, counts more than anything. So by looking and feeling, she'll have a sense of how close we are to the end point. I can always put a little more, but we're always cautious because, frankly, we can't take out what we put in.
But yeah.
Tiniest bit.
I don't know. You tell.
Yeah.
I don't know. That side might be good.
I think that side is good.
Okay.
I really do. I think our burden has always been to get
this
the left
side,
to match.
ridge.
Yeah,
okay.
Yeah, yeah. Okay, you're right. Just at the very top, just above where I've been.
I think that's it.
Okay,
and then I think we got it. Right. So I just think we need just maybe a little bit right here. I feel a little bit of that ridge. Mm-hmm. But up here, I think we got that.
Right.
Yeah, this feels really smooth, and then that one little spot, and
got it.
I think this side is amazing. This side we got it really well.
It's very important that both sides be even. Our eyes and our fingertips tell us what we need to do. And again, we're going for perfection here. So I'm going to drop in just the tiniest little bit of additional filler just in one little place. Perfect. All right. So again, you'll feel just a little pressure, just a little vibration going in. Yeah. Again, just the tiniest little bit.
It's a lot smoother. You can't feel the ridge as much as before. It's amazing. Yay!
You can just barely feel if you push hard. You can feel the edge, but I'll tell you, it sure looks smooth.
Oh yeah,
okay. But here,
definitely.
I want you to, see what
Isn't that amazing?
You know, it's very important that the patient and I agree, and that's the great advantage of doing this technique because the patient's awake. She's not under anesthesia. She can look, she can feel, because my aim is to make her happy. And it's a collaboration. It's the doctor and the patient figuring out what looks good and how do we get there. And it's a great process because when the patient walks out, they're comfortable because they know what they have. They can see the results.
I'm so ecstatic with the results, and although right now it's a little bit discolored because of the anesthesia, that goes away in probably about 30 minutes. I can go right back to work, and I mean, like Dr. Kotler said, you instantly can see the results. Absolutely.
Cool.